So the next topic I wanted to cover is on lutetium-177. So I've heard a lot of activity in Germany and in Australia. Can you speak to what lutetium-177 is? Is it an imaging? Is it a treatment? How does it work? And then we'll get into access.
So lutetium-177 is another brand new treatment that is almost certainly going to be life-prolonging, almost certainly will be FDA approved. The phase 3 trials, I believe, are completed, and they're waiting for them to mature. And I predict that they will show that lutetium-177 is life-prolonging for men with advanced prostate cancer, men that have had Taxotere, had Xtandi, Zytiga, those types of medicines, and those stopped working, and then they went on lutetium or a placebo, and the group that got treated, I predict, will have lived longer. Why do I predict that? Well, this medicine has been available overseas now for a while in Australia and Germany, and we've had patients that have flown to those countries that needed this treatment, that had advanced disease that wasn't responding to standard therapy. And we've observed good responses with relatively minimal side effects. And so they've taken this antibody and modified it, putting a high-energy lutetium-177 molecule attached to it that emits such powerful radiation that it will kill whatever cells that it draws near. So antibodies float around in the blood, and then they stick on the surface of the prostate cancer cells very specifically, radiating them and killing them. And this is a targeted type of smart therapy that it's been in development for 20 years and now is coming to fruition. So the treatments are given every 6 weeks or so as an intravenous injection. The most common side effect, because there are some of the same prostate-specific markers in the salivary glands that cross-reactivity with the salivary glands can cause some dry mouth in some patients. People can get low blood counts if there's too much exposure to the bone marrow, anemia, low platelet counts, low white counts, but thankfully that's not very common. Patients do tolerate it extremely well. It's effective, and we're keeping our fingers crossed that FDA approval will be coming up in the next year or so maybe.
So when you say dry mouth, is that just during the treatment, or would that be a permanent side effect?
Could be a permanent side effect.
Okay. Yeah. Is there anything to mitigate that?
Nothing specifically. I mean, there is some attempt, as we do with chemotherapy, to preserve the taste buds. We'll put ice on the tongue to shunt blood flow away during the infusion, and I believe there have been some attempts to put ice over the salivary glands. Not really sure how effective that is.
You know, you had said that you had good responses, so can you talk about a case study from your practice regarding this?
Sure. I mean, responses are easy to judge. These men all have PSMA PET scans prior to initiating therapy, so you can see where the cancers are and make sure there is a PSMA antibody on their cancer cells. 90% of men have it, but 10% don't. And then the patients then would go in, let's say their PSA is 100 when they go in, or they may have some bone pain, or they may have 14 spots of cancer. And then they'll get rescanned after a couple cycles, and their PSA is down to 20, and some of the spots on the bones have disappeared. So that's the kind of results you're hoping to get.
So how many cycles? Is there a minimum? Is there a maximum?
So patients are usually reevaluated after 2 cycles, like with any therapy, to make sure it's working for that individual, and then they can go on and receive an additional 2 to 4 cycles. There is a potential for cumulative bone marrow toxicity if you get too much radiation in your body, so you can't go on forever. But it has typically been set at around 4 cycles. They're given 6 weeks apart, so you're looking at 4 or 5 months of treatment.
So regarding access, I mean, is there anyone doing this in the U.S. that you could send patients to, or is it only happening in Germany and Australia at this moment?
Well, I believe there are still some small PSMA lutetium-177 trials still in the United States. I don't know if they're still accruing. You can go to clinicaltrials.gov and see where any trials, they're very selective in terms of the people they take, but if a person has the right profile, they could get it. And then I believe it is indeed still available in Australia and Germany. It's out-of-pocket cost.
Thanks for watching. If you would like more information about any of the topics we discussed today, go ahead and visit our website, pcri.org. Also, please subscribe to our YouTube channel and give us a thumbs up. We really appreciate it.